This is a town hall. Your voice, your future. Now, Brent Hunsaker and Natalie Hurst.
And welcome to our discussion about vaccines. And this is a rare opportunity to sit down with two sides of an issue and have a civil conversation, a conversation that we hope will give you information that you can apply to your own lives. We know that as parents and grandparents or future parents, we're all concerned about the health and safety of our children. And we want the best for our children. And that's really what this discussion is all about. And we have two special guests here today.
Yes. Let's begin by having you introduce yourselves to our audience.
Sure. My name is Alicia Laciando. I am a pediatrician at St. Luke's with their Treasure Valley Pediatrics.
And I'm Ashley Ourly. I'm a toxicologist and I work with Health Freedom Idaho.
And let's just start with your positions. And again, this is an informal discussion. You guys we don't want you to necessarily interrupt each other, but you're welcome to respond not only to our questions, but to what each of you are saying. Okay. And let's just start out with the basic positions. Where do you stand on childhood vaccinations?
So where I stand is that I want parents to be fully informed on the risks and benefits. Unfortunately, today, most families, when they go to take their children to get vaccinated, they get a lot of information on the positives, on the benefits of vaccines. Unfortunately, they're not being given the information that they need to know about the adverse events that can occur. And there's a wide variety, a wide range of chronic and severe adverse events that can occur after vaccination. And parents are just not getting that information.
As a pediatrician who does this day in and day out, I give vaccines probably to somewhere between a range of 10 and 20 children a day. I am very pro-vaccine. I've come from both reading about how these were created, why we do them when we do them, but also seeing the flip side of children who have suffered from these diseases and in some cases perished. And so I actually love to talk about vaccines. It's one of the things that I put the most time in my day for. Every parent is given all of the vaccine information sheets that are created by the CDC. I warn parents about the most common side effects that we see with these vaccines. And really everything that I do as a provider is about discussing risk and benefits, because parents come into my office worried, as they should be, worried about their children, worried about the decisions they're making for their children. And I am as well. Sorry. I am there to worry about their children, and so that's a discussion that we have.
And let me pick up on something you just said. Ashley, do you think that the CDC information provided is giving the whole story?
I don't believe so, because the scientific research that they're sharing with doctors, with the medical system, it doesn't reflect the enormous number of medical research studies by independent researchers that have found, like I said, that there are severe adverse events that it can occur. Even autoimmune disease can develop, and it can be latent. It can be a latent effect. It can take months or even years for these symptoms to manifest, and I know that sounds pretty wild. However, there's been a lot of medical research on this, especially with in regard to aluminum adjuvants in vaccines triggering autoimmune illness.
Do you see, therefore, do you believe what is a pattern then and not isolated individual incidents? I'm wondering what your responses would be to that.
Yeah, so children today and teens today are sicker than ever before. Even childhood cancer rates have been steadily on the rise the past few decades. In that same vein, vaccines. The number of vaccines that we're giving children today is at 72 doses of vaccines by the time they're 18. And so back in the 80s, there's a 300% increase since then, basically, is what I'm trying to say. And
300% increase in the amount of vaccine given?
In the number of doses of vaccines that have been given since the 80s, yes. And unfortunately, vaccines are actually not tested for their ability to be carcinogenic or mutagenic. And you know, this is something that when you look into the ingredients in vaccines, they are also potentially carcinogenic. And I just don't think that we can rule out vaccines because there has not been enough research on the subject.
There's a few things I'd like to respond to. One, in terms of research, I don't just look at isolated studies. that point one direction or another. I look for certain things, and when I talk to parents about what I'm looking at, what my colleagues at the CDC are looking at when making these recommendations, I'm looking for things that are peer-reviewed, so they're published in journals that are peer-reviewed. I'm looking at things that have meta-analyses, meaning that you're taking an aggregate. I'm looking at confounding factors, so we're not just looking at correlations as opposed to actual causation. Right. And I look also at the flip side. So yes, we do a lot. We give a lot more vaccines than we do. And my profession admits tens of thousands of less children to the hospital than they did even 20 years ago. I was talking with a colleague who is a pediatric nurse in the ICU, and about vaccines, and she was talking about having 4 children on her floor, taking care of them who were seizing from Haemophilus influenza meningitis at a time. Talk about my colleagues who are having to do spinal taps every night because once a month they would have a child with Haemophilus influenza or pneumococcal meningitis. And those are the things that, unless you've lived through that, you might not see it, but we see it. Rotavirus vaccine was introduced. 30,000 less children are hospitalized every year based on that number.
And you said this earlier. What you're doing is a risk analysis.
Yes.
You're saying what are the risks of the vaccine versus what are the risks of the disease that the vaccine is supposed to give you immunity to.
Absolutely. And I do that with everything. So when I look at adverse effects, when I'm recommending something as simple as Tylenol, ibuprofen, I know that I have far more patients who have an adverse reaction to those in the immediate or in the long term. And I have to balance whether or not it's right to give kids and in what situations it's okay to give kids those medicines. That is what I do for all of the recommendations that I give, whether it's sleep, it's eating. There are people asking me about food products, and they go through, well, depending on the type of food product, goes through testing as well. But you might not know the long-term effects. And so I have to balance that information every day.
One of the things that has made me curious is in looking at some of the information that you'll find online, you see this mentioning of the word herd immunity.
Yeah, herd immunity.
What's your take from your perspectives of what this means, and does this really apply to the situation? Is it a real thing to look at?
Yeah, I'd like to answer that. So when the concept of herd immunity was first introduced, it actually applied to natural infections. So unfortunately, vaccines cannot really provide herd immunity due to the fact that vaccines don't trigger the immune system in the same way that a natural infection would. So what happens is you have some short-term efficacy with these vaccines, and then eventually the antibodies that you develop will wane, and it will leave you vulnerable to infection again. And so what happens is, what we're seeing is that we'll have populations where there's 98 or 99% vaccination rates, and you're still having outbreaks of disease. We've seen this in influenza, measles, mumps, whooping cough, and chickenpox outbreaks. And one of the last measles outbreaks that occurred in 2011 in New York was actually started by a fully vaccinated 22-year-old. So what happens is we're vaccinating all these children. Even if we vaccinated 100% of the children in the United States, we still would not achieve herd immunity because these vaccines wear off by the time you're an adult, by the time you're around 20 years old, or even sooner than that. The pertussis vaccine, for example, wears off by the time the child is 5 years old. So what ends up happening is that we have an adult population that is largely not immune to these diseases. The people who are actually immune are those who are 50, 55 and older, who actually contracted these diseases naturally and have lifetime immunity. And once that population has passed on, we're in a big trouble.
I would like to clarify a couple of things. Herd immunity specifically means that it's sort of like transmitting a virus between computers. If you have everyone has malware or has a protection, one person who has the virus can't pass it to the 4 people around it. But if one person over here doesn't, it can go there, jump, jump, jump. So herd immunity is the idea that if everyone around you has protection or immunity, Even if you can't, so some of my patients who are cancer survivors are not able to get vaccinated, or they could get vaccinated, but they wouldn't be effective because they don't have a functioning immune system. There's no route of entry. They would not come in contact with someone who had measles. I'd like to be very specific about how we talk about immunity as it relates to these infections. We do know that some vaccines, pertussis, the current acellular pertussis, is a great example in terms of its waning immunity. Flu is different. Your immunity doesn't wane, but the flu virus
is changing.
Changes. Yeah. It has genetic drift and genetic shift. Things like measles, actually, we can do what's called titer studies. I've had some of these done myself when starting medical school, because I had all of my childhood immunizations, and they want to make sure that people who are taking care of kids are in fact immune. I had immunity to everything. I had immunity to hepatitis B, I had immunity to varicella, I had immunity to measles. Some of the vaccines are better than others. Measles in particular, it's been around since 1963, so we can at least say for about 50 years your immunity lasts that long.
And aren't there some boosters for some vaccines that are recommended after so many years?
That's right. And another reason why we do so many more vaccines now than we did before is vaccines have different purposes. A good number of the vaccines we do in the first year of life, when kids are getting the largest number of vaccines, we know that their immune system is not going to make memory immunity. We know that the immune system doesn't make memory immunity in most cases until about 12 months of age. So we are trying to provide small blips of immunity when kids are most vulnerable. We start at 2 months because that is when antibodies from the mom are most likely waning. And for diseases like pertussis, it is by far the most dangerous age. If you get pertussis at 40, it's very annoying. It's called the 100 days cough.
You got a bad cough.
Absolutely annoying. We can't do anything about it. I can't treat it. I can make you not infectious. I can give you an antibiotic that makes you not infectious, but it's annoying. If you get pertussis at 2 months of age, you have a 50-50 chance of not surviving, and there's nothing I can do about that either. You get a flood of white blood cells into the lungs. And so when patients come in to talk to me, and if parents want to ask, or I offer the opportunity, I will talk about every single vaccine and why we do it when we do it.
I'd like to make a mention about the pertussis vaccine. So unfortunately, the pertussis vaccine it's a very unique situation. So the FDA actually did a study on this, and they determined that using the DTaP and Tdap vaccines, that when you are vaccinated, your immune system is open to infection with pertussis. So you can actually contract pertussis, but not exhibit any symptoms. So you can become an asymptomatic carrier if you're exposed to the pertussis bacteria in public. What happens is that you can then transmit whooping cough to those around you unknowingly. So it scares me because there's a lot of parents nowadays who are worried. They're rightly worried about pertussis because yes, it is scary in infants. However, the pertussis vaccine actually leaves infants more vulnerable because people are getting these vaccines to protect a newborn child in their family, and then they could potentially contract it without knowing, showing no symptoms, not understanding that they might need to be away from the baby, and then pass it to the newborn child.
I have not seen that study. I'd be very interested to see it, especially as it relates to the fact that we know that infants who are immunized are much less likely to contract pertussis. So every infant I've ever seen, and population studies show this as well, who was positive for pertussis in the pediatric ICU was unimmunized. Most of the time it was because they were under 2 months of age and were exposed to someone with pertussis who was unimmunized as well. In fact, we know, this is my big plug for Tdap during pregnancy, the best way, more than cocooning with people around you to be vaccinated, the best way to prevent pertussis is to increase antibodies in the mom during pregnancy that then provides almost 90% decreased risk in infants in that first 2 months.
Yeah, there were studies done on cocooning, and they found out that it didn't actually benefit the newborn. And then, but I did want to mention Tdap vaccination in pregnancy is a really big concern of mine because it contains aluminum, And these aluminum adjuvants in vaccines are designed to provoke the immune system. The reason why they provoke the immune system is because it's toxic. Now, many people will say that the amount of aluminum in vaccines is so small that it's not harmful. However, the scientific research shows that this is not the case. So what they're not considering is that there's a difference in the route of exposure when you are given a toxic substance. So if you eat something contaminated with aluminum, your body deals with that very well. You only absorb 0.4% of that aluminum that you ingest into your body. However, when you're injected with a vaccine that contains aluminum, you absorb 100% of that aluminum. So you have to do the mathematical equation there in order to calculate how much aluminum you're really getting. Unfortunately, what happens is that aluminum can be taken up by cells. It's then transported to other areas of the body where it's deposited, and it can be deposited in the brain. So what we're seeing is that this aluminum adjuvants in vaccines, which about 60 to 80% of vaccines contain aluminum these days, they're finding neurological damage and, again, the autoimmune disease occurring as a result of these vaccines.
Here's one question I have, just as a reaction to this, here what I'm hearing. What's your take on if we were to just eliminate all vaccines altogether? I'm wondering what you both have to say.
My practice would be very different. I have talked with my pediatric colleagues from who have been practicing for 20 years, 30 years, 40 years. My practice would go from what I consider a practice of prevention, of education. Most of my job is educating, guiding families. Occasionally I treat illness, but most of it is guiding families through. If we had the same number of hospitalizations before, my job would be triaging. My job would be putting out fires and really trying, I'd have to, there's a lot of things that I don't have to look for nearly as much that my colleagues even 15 years ago did, whether it's fevers in newborns or epiglottitis, worries that I don't keep me up at night the way they did my colleagues. So I would be spending a lot more time trying to keep kids healthy and keep them out of the hospital than right now what I get to do, which is talk about the whole child, talk about mental health and education and everything going forward.
Now, Ashley mentioned, and you used the word toxic, the aluminum that's in some vaccines. At one time, I guess with multi-dose vials, there was also a mercury-based preservative that was used. I don't even know if that's used anymore.
It is not.
In flu vaccines.
I figured that there aren't very many multi-dose vials.
The multi-dose flu vaccines do, yeah.
But she said toxic. What do you say to that? She calls those elements in the vaccines toxic.
So they are heavy metals that in large doses can cause problems. So the best aluminum studies I've seen as they've related to the brain relate to people who work in smelting and heavy metal, where you have an occupational exposure to those things. They've done excellent studies, again, because we do this as a profession. I put my professional reputation on the line every day to do this. The serum concentration of aluminum, how aluminum would get transported once given vaccines is, I don't want to quote numbers because I read them, but I don't want to misquote. I got everything from the CDC. The serum concentrations do not increase after doses of these vaccines. So there's no evidence that aluminum is increasing the natural base amount of aluminum that we come in contact every day.
Already in the bodies. Yeah.
So in response to that, what ends up happening is that the aluminum doesn't hang out in the bloodstream for very long. So that's why you don't see blood levels of aluminum rising after vaccines. What happens is that it's either trapped at the injection site, and that's one reason why some people get the localized reactions, or a welt even, or it's quickly transported to other regions of the body, the brain, other organs, things like this. And so when you do blood levels, when you check for that, it's not going to show up.
You're saying it's hiding in the body, literally going into organs like the liver or kidney
and there have been
brain.
studies on this where they found that the aluminum stays in the body 96% of the aluminum stays in the body after 28 days, I believe.
So I guess my question would be, how are those studies done? Are they post-mortem, where you're analyzing tissue, or are there, because there's no, it's if you can't test it via serum, if you can't test it via biopsy, how else would, I'm trying to think of a medical way that is tested.
Can be verified.
Yes.
Right. This particular study, I believe, was a rabbit study where they did an experiment and they gave rabbits the aluminum, and then they decided to figure out where the aluminum went.
Mm-hmm. And I want to look at dose dependency,
Dosage.
And I completely understand, especially I know a lot of people are worried about something like formaldehyde, which is also our body actually makes. These elements, these things are better studied and better looked at for safety reasons than any nutritional supplement that you can buy, because those are not regulated, those are not studied. So, and they're continued to be tracked and looked at. I feel, again, 100% safe discussing the risk and benefits of these things, knowing what ingredients are in them. There are circumstances where vaccines are not appropriate for my patients, and I talk through those, or we decide on a different schedule. But I recommend the vaccine schedule as is, knowing what these things are in there.
So I did want to say about the aluminum having been studied. Actually, there has been no research to determine what is a safe level of aluminum to inject into the body. Now, we are giving vaccines containing aluminum on day 1 of birth, then at 2 months, 4 months, 6 months, and so on. This is during critical neurodevelopmental stages of a child's life. Now, the aluminum, you have to, like I said, consider the repetitive nature of it, but also the fact that it's being injected into the body. And there's plenty of scientific research by independent scientists and even experts in the field of aluminum toxicology, which have determined that even in vaccine-relevant amounts, at very, very small amounts, the microgram level amounts that are in vaccines, that aluminum is causing neurological damage.
Let me go back to what Natalie asked just a few moments ago and give you a chance to answer.
Okay.
You know, I went through this before I went to Africa a few years ago following a humanitarian mission. I felt like a pincushion. Starting like 3-4 months before my departure, I was shot with this and that and the other in a series. I had an oral vaccine that I had to take for, I think, 7 days. Are you saying that risk rewards, are you saying that if I would have been better off not to have taken all those vaccines and then just gone to Africa and taken my chances with the natural pathogens that are out there? Or was I better off to get the vaccines?
I think this is a multifaceted issue. It's very, very complex. I don't feel right suggesting one or the other to somebody, but what I would say is that for most viral diseases or infectious diseases, nutrition is the most important factor in your ability to recover from them. And the problem is
not that it's going to insulate me from them, but my ability to recover from them.
Yes, absolutely. And there is actually a lot of evidence that infections like measles, mumps, and rubella, and chickenpox and whooping cough, if you have had them in your lifetime as a child, you have a reduced risk of cancer later in life. They train your immune system in ways that vaccines cannot. So the biggest problem in the world today, the reason why so many children and individuals in and around the globe are dying of measles is precisely because of poor nutrition. There have been so many studies on this, and even the World Health Organization today will recommend that if someone comes down with measles in low to middle income countries, that they should be given vitamin A. Vitamin A prevents and helps reduce the risk of complications and death from measles. And this is the case with, like I said, many infections that we have to deal with today. Most of them are not harmful long term for those who are well nourished. And so, unfortunately, I think it really depends on the person whether or not you feel good about getting the vaccines, whether or not you think your immune system is robust enough to deal with them. I feel like that really should be up to the person.
Well, if I was going to go on that trip, I had to have the vaccines.
Right.
By the way, they didn't protect me from the common cold. The last day there, I got a cold.
Of course.
But
I do want to point something out, and I agree that nutrition changes the numbers. So you look at measles in 6 countries in Africa where it is still endemic, where 1 in 4 kids are suffering significant consequences. A lot of that is nutrition-based. But we now have, to go back to your question about what would happen if we didn't vaccinate, we now have some good information looking at our neighbors in Europe. So in the EU, you have vaccine rates that have, so in our country, 91% of, or over 90% of people are either immunized or have immunity to measles. Because it is so contagious, you drop that number below 90, risk goes up of outbreak. Europe has had steadily decreased numbers of vaccines and steadily increased or exponential increases in numbers of people suffering from measles, including 83 deaths in the last year. So last year, I believe the number was 2 years ago, there were less than 4,000 cases of measles in Europe. Last year there were 63,000 and 83 deaths. And that number continues to go up as rates of measles goes down. So it's actually to the point where the CDC recommends for travel to endemic places, children to get the MMR vaccine actually before 12 months, which is when we normally give it, to provide limited protection while traveling. And that now includes Europe in addition to places like Africa and that thing, and et cetera.
And I wanted to just mention, you wouldn't think it, but actually in the U.S., over half of all people living in the U.S. are not getting the RDA, the recommended daily amount of vitamin A. And so they found in studies that even children living in the U.S. and developed nations, the measles virus actually depletes vitamin A from the body. And so even children who are vitamin A sufficient will end up with deficiency if they're not being well nourished, if that vitamin A is not being resupplied, it can be a problem. And so that's why even in developed nations, people who are undernourished or malnourished can still have complications and even die from measles. And that's why I would really hope that our world would focus more on nutrition and getting children what they need in order to be healthy and robust.
But even, I mean, we were talking about, children with measles in Africa versus, say, children with measles in Washington State, where there's been an outbreak. It's true, nutrition has got to be a component of this, and we both agree on this, right? But
there's a component, and I agree.
As a component, but are there other components as well? In a developed country like the United States, wouldn't the quality of care be better than they would, say, in Africa?
Yeah.
And so there are other components, too, that increase the ability of someone to respond and survive the disease.
There is. And for 2 reasons. Most people who pass away from measles or are hospitalized with measles because of secondary complications. So first of all, I want to respond that you can look the article up on NPR, did a great job talking about how measles, live measles, not the vaccine, wild type measles, wipes the immunity that you have already created to other illnesses. And they tried to figure out why people who were getting, once the introduction of the measles vaccine happened in an area, their rates of contraction of other diseases went down. And it was very confusing until they realized that by checking titers, that it basically, when you get measles, you lose your immunity to varicella, to Fifth disease, to a whole host of other diseases. But I also want to point out that the most common complication is secondary pneumonia. And we are more equipped to take care of people in the hospital, treat them with antibiotics if necessary, than in other places. Absolutely correct. But I'm not just trying to prevent deaths. Again, I'm trying to prevent families from having to go through. If you have ever had a child hospitalized, the amount of stress that causes, it's actually been studied, the levels of PTSD for parents who have had children hospitalized is quite high. And, and the flip side, even if dehydration, you can imagine if you've had to try and keep a 1.5-year-old, a 3-year-old hydrated when they have 105 fever for 5 days and feel absolutely awful. It is, and then you have to ask them to drink twice as much as they normally do. It's almost impossible. You're sitting there with a syringe just forcing it on them. So they end up getting hospitalized for IV fluids. And I would, again, risk-benefit, would much rather a family not have to go through those things than the theoretical risks that, again, have not been borne out of the vaccines.
So I wanted to make a comment about the immune amnesia, because that is a more recent finding that has been found when it comes to measles and it wiping out your immune system or making you more vulnerable to these other infections. Now, one of the things that they haven't been looking into is the vitamin A. What happens, like I said, the measles virus reduces your serum levels of vitamin A. Your liver stores vitamin A. When you have measles, your liver begins to get that vitamin A out into the bloodstream to combat the virus. Now, they found that the measles virus, vitamin A actually inhibits the measles virus, and that it gets into uninfected cells and upregulates the innate immune system in order to defend those cells against measles and the measles virus using the cell to replicate. Okay, so what happens is, even in people who are seemingly healthy and they recover from measles, okay, what happens is they've used up those vitamin A stores in their liver. So vitamin A, like I said, protects cells against subsequent infection as well. They're not looking at the vitamin A, they're not looking at the role that it can play in leaving cells, when you're deficient, open to and susceptible to secondary infections like this.
Again, I haven't seen this statistic about half of our children being deficient in vitamin A, but I do know I would look at a population that is naturally deficient in vitamin A or low on it, are cystic fibrosis patients, excuse me. They do not absorb fat. Fat is required to absorb vitamin A, D, E, and K, and they are chronically low in vitamin A. And if that were the case, I would expect them to contract these diseases, whether immunized or not, at a much higher rate. That is not the case.
Let me ask you real quick, because we're starting to get low on time here.
Mm-hmm.
Okay.
This is a policy question, and Doctor, I'll start with you. The American Association of Pediatrics recommended that states that now have exemptions for religious or philosophical reasons to immunizations, that those states repeal those exemptions. And they say, no, everyone should be required to have this if they're going to go to public school. Do you agree or disagree with that recommendation?
I am not a policy person. I am a physician, so I am not, as a voter, I would vote for that, purely because I think of, again, of my patients. There was a great article, an op-ed out of Ketchum, about a patient, 16-year-old girl who had a bone marrow transplant because of leukemia. And based on the vaccine exemption rates in her high school, she was, even though she was all excited, her twin got to go to school, she did not get to go to public school because the risk would be too high of her to contract a disease that she could not fight off. So,
because too many of the classmates at that school were not immunized
and had non-medical exemptions. And the parents wrote this op-ed talking about the heartbreak that she went through, not being able to go to prom, not being able to do those things. So folks who are making this decision are not just making this decision for themselves. They are making a decision for my patient with sickle cell disease who has to get blood transfusions, so we are not able to immunize him. Making decisions for folks who might not be able to pay for, if that's their option, then they're left trying to juggle homeschool and pay for those things. And so they're making decisions for all of those folks. So my belief is yes, I think we should eliminate medical exemptions or non-medical exemptions for public schools.
So I would say the opposite. There are a lot of parents who don't want to vaccinate today, like you just mentioned. However, the reason why is typically because they did vaccinate and then they witnessed their child having an adverse reaction or develop a chronic condition shortly after vaccines. Now, there's the system called the Vaccine Adverse Events Reporting System. And the CDC states that around 30,000 reports are submitted to VAERS, for short, every single year. Now, there was another report that was done and funded by the Department of Health and Human Services. And what they found was that less than 1% of all vaccine adverse events are ever reported to VAERS. So when you consider the fact that 30,000 reports are made to VAERS each year, and that represents just 1% or less of the actual adverse events that occur after vaccination, that number is actually 3 million or more. When you consider the fact that there are 287 million vaccines administered in the year, or in the US each year, you can't make the claim that it's a 1 in a million chance to be harmed by a vaccine. That's a 1 in 100 chance, or less, or sorry, more. There's a greater chance than 1 in 100 of being harmed by a vaccine. And there's also a genetic factor as well. So my son has a genetic defect that makes him more vulnerable to vaccine injury. There's actually been a study done that found that this particular gene makes you more susceptible. And it's a gene that makes your body not able to detoxify the things that you come into contact with. So things like the aluminum in the vaccines. Now, 10% of the population, it's been suggested that 10% of the population has a severe form of this gene defect, but that close to 60% has the more mild form of this gene defect. So when you start taking away these religious and philosophical exemptions, which, by the way, there's a reason for the religious one, especially because some vaccines are manufactured using human aborted fetal cells. But besides that, when you start taking away religious and philosophical exemptions, you're basically saying, okay, we're going to mandate harm on an unknown portion of the population in order for them to go to school.
As we bring the conversation to a close, one of the things I'm wondering about is some common ground here. So I'll put you on the spot and say, is there one vaccine out there where you two find agreement and say, yes, that's the one to go with if you go with nothing else? Or is there an across-the-board approach where you say, you know what, no?
I leave that up to you because I personally have received all of the vaccines. I have vaccinated my family completely, and outside of, again, discussions with people about their specific circumstances, recommend all of the vaccines. So I would leave that up to you if there's one.
Yeah, you know, that's something that is difficult for me to answer because I don't like to make decisions for other people. A lot of people come to me for information on vaccines, but I don't try to tell them what they should do or not do. And that's something that, again, should be left up to parents. I love that Idaho here, we are for parental rights. We are for health freedoms. I think that if Idahoans knew, you know, that over $4 billion of the American taxpayers' money has been given out to victims of vaccines, and that the manufacturers and medical professionals who are administering vaccines have no liability if their children are harmed by a vaccine, and that there's a significant risk of harm, well, I think that they would be very interested in making sure they can preserve their rights to refuse or decline medical interventions and pharmaceutical drugs like this. So that is my big concern. Is I just want people to be fully informed. I can't even really answer that question because, but for my own family, I have chosen to forego vaccines at this time. But I have also chosen to really focus on making sure that I support my family, their health through nutrition, and just making sure that we are doing preventative things that we can do besides just vaccines.
This is where we go to the bottom line right now. Okay, folks at home, what do you want them to take away from your point of view in this discussion today? Ashley?
Gosh, I just want them to take away that the information that we're being given on vaccines is unfortunately the tip of the iceberg when it comes to the amount of research that has been done and the amount of information that is out there on vaccine ingredients, on their adverse events from vaccines, on the toxicology. And so we haven't even gotten into whether or not we can trust you know, the CDC to give us accurate information. You kind of touched on it a moment. But there's also the issue of, you know, vaccine manufacturers and the fact that they've all been convicted of fraud. And even Merck is in court right now for the efficacy of its mumps portion of the MMR vaccine, and it's also in court over the HPV vaccine right now. So there's so much information. It's a multifaceted issue, and you can't just point to one or two pieces of information and make your decision based on that. It's a whole host of variables that factor in. And so I would just encourage parents to really dig into the research, keep an open mind, and I unfortunately can't, you know, make a recommendation, but just be fully informed.
Doctor?
Bottom line for me is, one, I think we spend a lot of time talking about fear and worry. And I also want to point out that that over 90% of Idahoans who send their kids to school choose to vaccinate. And there's no arm twisting. You don't have to sign any particular form to opt out. That was a piece of legislation that was put forth. Over 90% choose. And I would agree that there is a whole host of information out there. The internet has opened a whole can of worms in terms of what we can access, for better or for worse. But I would think to yourself, think who you trust to help you navigate that information. And I would hope that if you are seeing a provider who you don't trust, you would find a new provider. Liability-wise, I put myself on the line every day. I carry medical malpractice insurance for a reason. Every decision that I make, I know, comes with risks and benefits, every piece of advice that I give. And I want my families to be able to trust me and trust the information that I present. And the information that I present, of all of the things that I offer, the things that I feel have the most research behind them, that have the most benefit to risk ratio, are vaccines.
I think that wraps up our discussion.
Okay.
I think we put a period and say thank you to both of you for taking the time to talk to us, and
Absolutely.
we appreciate you sharing your insights and your opinions.
Mm-hmm.
And we hope it helps people at home to understand this issue better, because it is important. Like I said before, this affects all of us. Mm-hmm. You know, I had to get vaccines, you know, for travel abroad, but my kids, we've had to make that choice for them. Do we get them vaccines? And in our case, we chose yes. Mm-hmm. But that's an individual choice that everyone has to make, whether it's for your own kids, for kids that you're a guardian for, in some cases even grandkids. Mm-hmm. You know,
and
you're
for your
faced with that
community.
decision.
Yep.
Yeah, and for your community as well, as we see in Clark County, Washington, what's happened there with the measles outbreak. It doesn't just affect you, but it affects those around you. Again, thank you. I appreciate your time.
Appreciate it.
Thank you. It has been very informative.
And thanks to you for watching.